Wait, you said we all right. Let's pretend to let them start and then stop them 3 times or 4 times.
Within the first 30 seconds?
Within the first 30 seconds, and then make them start over again. All right.
Wait, should we actually?
No, don't.
All right. Do you guys want to clap?
Yeah.
Before we begin, we'd like to acknowledge a few people. First, we'd like to thank Alexa for helping us out, and our mentor, Avi Lamani. We'd also like to thank Mr. D, and one of the reasons we want to thank him is because he teaches us all about the fight against cancer. And you guys heard there might be a quiz. We're not giving a quiz, because it's more important that you guys learn about how we can fight this disease.
Right. Who here likes to sit in the sun? I can. No, I can't. Now, can anybody guess how many people are diagnosed with melanoma every year in America? Yeah.
229,000.
No. There are over 75,000 people diagnosed with melanoma every year just in America, and almost 10,000 people die from it. It's the most dangerous type of skin cancer there is. So just some more basics on melanoma. It's caused by too much sun or UV radiation, and it's spotted by an irregular mole on your skin. So that doesn't mean that every single mole means you have melanoma. So for a mole to have melanoma, it has to have A, B, C, D, E. A has to be asymmetrical, B, an irregular border, C, color, D, about 1/4 of an inch in diameter, and E, evolution, which just means it's going to be changing over time. So most times melanoma is treated with surgery, but our drug Keytruda focuses on stage 4 melanoma, or inoperable melanoma. Keytruda is administered at 2 milligrams per kilogram every 3 weeks. And just to clarify, that means 2 milligrams of Keytruda per 1 kilogram of your body weight. So it was developed here in New Jersey, in White House Station, and it was FDA approved in September of this year. So the basic mechanism of Keytruda is to block a cellular pathway called PD-1. And what PD-1 is, it shuts down the immune system, but we'll go into the mechanism more later on.
So pembrolizumab, or Keytruda, is a part of a class of monoclonal antibodies. And antibodies are molecular markers that are able to target the infected or foreign cells and destroy them. So there are similar therapies in this class that are just like pembrolizumab, but each of them has their faults. So urelumab targets the CP137 receptor, but when they did the trials, they determined that there were side effects that were too harsh, which included death. Nivolumab has the same function as Keytruda. It blocks the PD-1 from its ligands, but they found that patients relapsed and the disease progressed. Now, both urelumab and nivolumab are fully human, as compared to pembrolizumab, which is humanized. And humanized drugs are when they take the cells, the antibody from mice and inject them into a human. It's usually more effective. Tremelimumab binds the CTLA-4, but when they were doing the trials, they decided that it was no better than chemotherapy. And the most popular one, which was the predecessor to pembrolizumab, was ipilimumab, which also targets CTLA-4. It turns off the mechanism that allows cytotoxic T cells to destroy cancer cells, but this also had side effects that led up to and lead to death.
So are there any questions on similar therapies?
So what's the takeaway about the therapies?
They all have faults. And also, we're not trying to say that pembrolizumab, is the end all be all, because it's not. What we have right now, like pembrolizumab, is what we're working with currently.
And this is just kind of like background things that are similar, what teachers along the lines of.
If nivolumab and your drug do like the same thing, why is the relapse in that one?
It's fully human, as compared to pembrolizumab, which is humanized.
What's that a picture of on the right?
That's the mechanism of urelumab.
That just
Like targeting the CP137 receptor.
In your second bullet point, you say nivolumab acts on its ligands. What exactly does it do with its ligands?
Right, so
Its ligands. Sorry.
it does the same thing as Keytruda does, like from the PowerPoint, the video. That's the next slide.
Yeah, well,
So,
yeah. Wait, were there any other? I thought I saw them. Yeah.
Could you use surgery to get rid of the melanoma spot?
Oh,
Do you know?
well, what Keytruda when melanoma reaches stage 4, that means it's gone into your bloodstream. With the surgery, it's on your skin, so it doesn't dig that deep. But once melanoma reaches into your bloodstream, it spreads, and if you try and operate, it would like burn tissue and it would work. Yeah.
I don't know. Sorry, I don't know if you went over this already, but I was just curious. What about the radiation causes skin cancer?
We didn't research that.
Okay. That's not fair.
So this is what the PD-1 pathway looks like in melanoma. This is if you have melanoma and you're not using a drug right now. So right here is the T cell. T cells are part of your immune system. What they do is they bind and they kill the infected cells. Now, here's the tumor cell. And on the T cells, there's a protein called PD-1. PD-1 stands for programmed death receptor. And on the tumor cell, you have PD-L1, which is the PD-1's ligand. So in melanoma, what happens is the PD-1s on the T cells will bind to the tumor cells, bind to the PD-L1s on the tumor cells. Then this ligand, PD-L1, is going to release a signal. It's going to tell your immune system, no, this cell's okay, don't kill it, even though it's not, it's infected, it should be killed. So,
Wait, PD-L1 releases a signal or PD-1?
it's like when it binds.
Is it PD-1L or PD-L1?
PDL1. We didn't make a picture.
It was called PD-1L and PD-L1, and like both, they were both.
Okay, that's it.
So, you guys all watched the video last night, right?
Oh, yeah. Yeah,
Alright.
so this is what it looks like in your body if you are using Keytruda. So here is the T cell again, here's the tumor cell, and this white stuff is the PD-1s. So what the Keytruda does is it binds the PD-1s. So then the PD-1s aren't able to bind the ligands on the tumor cells. So that signal can't be released. That means that the immune system is back intact. It's told to kill the cancer cells again. So, are there any questions? Yeah.
So, do other cells bind to PD-L1, and would Keytruda inhibit that process too?
So Keytruda, it's a target therapy, so it does attack like healthy and cancer cells. But from my understanding, there's not that same like combination. Like the PD-1 and the PD-L1 isn't in every single cell.
Like it binds the PD-1 so that PD-L1 can't bind. That's what Keytruda.
Yeah.
What's PDL1 again?
Okay. PD-L1 is the PD-1's ligands.
What are ligands?
Ligands are something that moves signal. And yeah.
So I just want to clarify. So when PD-1 binds to PD-L1, that tells the immune cell that it's fine and it won't attack.
Right. So you guys all watched the video last night. So when the PD-1 binds to the PD-L1, it's like the scanner can't tell it's a fake ID.
It's like that signal was rare when you send that.
They're just gonna say like, he can go in, everything's fine.
Are there any other? Yeah. And what's the problem with PD-L1?
Well, the problem with PD-L1 is that it's letting these cancer cells into the immune system.
Okay.
What if I?
It's identifying the cancer cells as human cells. Preventing.
Great. Okay. Is that it for the mechanism of fusions?
All right. Experiment with that. So they did a study with 294 patients where Keytruda was the only drug, but they weren't only testing for melanoma. So we saw there were potential, help with lung cancer or prostate cancer, but we're focusing primarily on melanoma today. So there was a 28% overall response rate for melanoma. And they also found that at a dosage of 3 milligrams per kilogram, there was a 41% response rate. And so, talking about this diagram, which is a little bit hard to see, but you can see there's these bars in the middle, which show the median values. As we go across this side, we're increasing in dosage. So basically what this is showing is that as dosage increases, Keytruda becomes more effective. Yeah.
On that graph, how is it showing that Keytruda is becoming more effective? It looks like they're all on a straight line on the y-axis.
I mean, it's not significant, but it's going up. Sorry, and it's hard to see. Alright, so patients who had PD-L1 in their tumors, 36% of them showed an objective response, as compared to 0% who did not. Okay, so blue did not show objective response, and gray did show objective response. An objective response is when your tumor shrinks by 30% and does not regrow. So what this shows is that when the tumor does not have PD-L1, basically Keytruda does not work, but it does work when like 36% of the time when there is PD-L1. So when we compare this to chemotherapy has an average survival rate of about 9 months, but in this study, 62% were still alive after 18 months. And down here we're showing, this graphic is the accuracy of Keytruda in melanoma, and this shows like border and tumor baseline. Yeah.
What are those like really like dotted lines trying to represent? You see all the graphic of like that dotted line going across. What does that represent?
I'm not sure actually.
The first bullet point says there was 20% overall response rate. Then how is 62% alive if only 28% of them respond to it?
Alright, so like 62, so like that doesn't mean that they died right away. Because like melanoma, they kill you right away. But 28% have like their tumor shrinks.
But like, is the point of it for the tumor to shrink? So like, if only 28% of them are having a response, how is it like? How can 62% be alive after 18 months?
Well, I mean, some of the people that responded didn't die. So like if you look down here, so like this is how big the tumor is. So this guy actually went off the study and his tumor got bigger. So 60, like all right, 28%. I know I'm throwing a lot of numbers at you guys, and I apologize for that. So if there are any questions, you can ask me. But 28% are the people whose tumors shrank some, but 62% were still alive, meaning that what, like 40% were not killed by this disease, but their tumors did not shrink.
Does Keytruda, does Keytruda shrink the tumor, or does it neutralize the tumor, or can it do both?
It stops the proliferation of cancer cells, but it also, I'm not sure how exactly it works, but it unlocks something else that can potentially shrink.
So
that's it.
It's primarily just to make it sense in the tumor.
Yeah. All right.
Okay, sorry, you can ask us the rest after in like 2 minutes. So what does Keytruda mean then for the scientific world? How is it going to affect it? So only 10% of the Keytruda patients experience side effects. And compared to the 100% of people using chemotherapy experiencing side effects, I think that's pretty significant. So right now, Keytruda is the 6th most expensive drug on the market, and it's $12,500 every month for every patient. So because of that, it's not that widely available to people. And however, there are current trials underway for things like renal cell cancer and other solid tumors and blood tumors. And Keytruda has the mechanism that turns back on your immune system. It's using your own body to combat itself. And because of that, this mechanism will spread and it'll lead to other breakthroughs in cancer research. And even though this drug isn't perfect, it's not completely refined, there's still a lot of errors, it's a start and it's a new idea and a new way to go about fighting cancer.
It's leading down the path on for future drugs.
Right. So
Do we see it or?
I dropped it before. On the slide with the data, you said something about 62% alive after 18 months. That's people that, so the Keytruda may not have affected them, but they're still alive,
Right.
or that Keytruda only
Also,
to neutralize the tumor and just didn't shrink.
so also you have to take into account that melanoma was not the only cancers in the study. So there's like prostate cancer and lung cancer. So
Can you explain the bottom graph? Yeah.
I know it's really it's hard to say, so it's confusing. But basically, it's like how well does Keytruda work in patients with melanoma? And I'm sorry, but like the blue is when the patients go off the study, and red are if they're still on the study. So
What do you mean go off the study?
so like they decide, you know, they don't.
They just don't want to continue
Right.
the
So
drug.
they can be due to a number of things. Like they got some bad side effects, or yeah.
You said like they were comparing this kind of case study to other like cancer studies, like different types of cancer studies.
So no, okay. So in this study that they did, where there was 294 patients, only a percentage of them had melanoma. So they treated patients who had prostate cancer, lung cancer. So it's not like comparing to other studies. It's like within the same study, same drug, but different.
Also, this we treat many different types of cancers.
Yeah, not
Well, not treat it, but like I try to help it.
right.
Just for clarification, Keytruda doesn't kill the tumor cells, it stops them from growing. Okay.
Well, and it can also, but primarily it's not proliferation.
Did they try making drug cocktails with Keytruda, with Keytruda and another one to shrink it,
They're actually, there was a study using ipilimumab before Keytruda, but we decided to just focus on Keytruda this time.
And also there was another study, but we didn't feel like the sample size of patients was sufficient enough. There's only 94 patients, so
You said only 10% of patients experience side effects, but what were the side effects? There were things like feeling tired, coughing, nausea, joint pain, diarrhea. Those were, I guess, the main ones. There were a couple more.
pretty cool. That's that. Because
yeah.
Merck actually sent us a list of side effects. Overnight stress and now.
Right.
Just exactly.
Julia.
I forget my question, never mind.
Is the drug directed or injected directly into the tumor?
It's into your vein.
How does it find like a target the tumor?
It's targets.
So if it stops proliferation of tumor cells, how would it stop proliferation, or does it stop proliferation of healthy cells too? Does it stop replication?
It doesn't stop proliferation, right? It targets.
It allows the immune cells, like T cells, to find the
Yeah,
tumor.
it shuts down target. Yeah. Like in the video we seen last night, they're saying get him, so they take out all the dead cells.
So you said that stage 1 melanoma spread to bloodstream. So does it go because the tumor it's not in one place, so how
I'm crying because you're asking.
it's you said that it's in the bloodstream the cancer. So how does it know not to go to one place?
I mean, it'll spread. What might start out on your leg could go to your tongue.
And it also targets healthy cells also, which is a problem.
So my question is that does it only work for later stages of melanoma because melanoma starts with the skin and goes?
Well, you could try it for stage 1, but with stage 1 melanoma, it's barely effective to treat with just surgery. It's 100% effective.
What about, but you did say a higher dosage of Keytruda makes it more effective, correct?
Yes.
What about that makes it more effective?
Well, I
Not exactly.
guess you would. Oh, I'm sorry.
I'm not making a face. That's just my face.
Is it because there's a limited amount of molecules to bind to the PD? So the more you have, the more you bind to.
I mean,
I wish I knew.
I guess that would make sense, but it didn't say. Are there any questions?
Please step. Please step out of the room. Claire, can you stop the?
I just pressed the red button.
Don't press the button.